I get asked a lot, how come no one has ever mentioned this about my child? Not the ENT, not the pediatrician, not any other dentist. Well, unfortunately, a lot of doctors in any specialty are not really trained to assess for these things, and they don't know how to improve them. Dentists are the first line observers, so we have the best ability to be able to assess how these things can affect your child's teeth, their jaw development, and their airway. I had to take extensive airway courses to help better manage these issues in your child, and I am so happy to be able to offer these services all under one roof at CVD Kids Dentistry. So I see this all the time where there's a kiddo in our office that comes in for just like a regular check for cavities and cleaning, and they have extremely crowded teeth. And so recently, this past week, I actually saw a child with really, really narrow dental arches, and their teeth were really flared, which tells me that they have a tongue thrust habit, and that's actually super common. So why is that happening? The tongue tends to posture forward when your kiddo is sleeping because it helps them create more airway space in the throat for their tonsils and adenoids. We saw this kiddo in our office 6 months ago, and we actually referred them for orthodontic care, which I was hoping would be expanders. They visited us this past week with no expander in their mouth and just braces to correct those really flared teeth that they had. So let's talk about why braces don't just fix these things. The orthodontist had the best intention, which was just to straighten the kid's teeth, which is what the dad was asking for. Unfortunately, the chances of relapse in this orthodontic case are really high, and I see this all the time because the kid is still thrusting their tongue forward when they sleep, and I did ask the dad, and the kid is still mouth breathing. So if the orthodontist was able to do expansion first and focus on orthodontic alignment later, the child would probably stop thrusting their tongue forward when they sleep. They would be able to have more airway space so that they can be nasal breathers for the rest of their life. But unfortunately, at around 12 years old, there really isn't that much we can do other than tooth alignment or surgery to help out. Together, we can help the youngest generation live long, healthy lives where they develop into their best selves.